Hey, Dr. Fisher here. This is another one of our great questions in a series of our frequently asked questions. This we hear not that often, but often enough that we wanted to address it. Some people ask, hey, is it normal for me to feel pain or feel discomfort while I'm using Fisher traction for the neck or low back? And right away, my first reaction to that is, yes, it is. Not in every situation, but in enough where the change that you're experiencing from the traction forces can and may cause some discomfort. And remember how the saying goes, no pain, no gain. And it is very, very true when it comes to real therapeutic types of treatments where there's real change happening. You got to stay mindful of what the long-term results are. Even though I know many of you are going to be looking for that immediate relief, and a lot of you will get it, but not all of you will. So do not stop, do not quit early. Keep trying it for at least 30 days. In a lot of cases, we'll see that your muscles and tissues, ligaments, and joint capsules, they'll be stretched, much like the discs of our spine, where when we have a disc bulge or herniation pushing out, the traction forces are going to pull strong enough to create that suction and pull that disc herniation back in. At the same time, they're going to stretch and pull the muscles of your neck or your low back. And if your body's not used to that, where let's say possibly you've had a chronic condition for many, many years, and there's been shortening of your muscles on one side or both sides of your spine. Now traction comes in, does the opposite of that shortening, elongates your muscles and pulls on them and stretches them. Your muscles might fight with that. We call that either muscle splinting or we call it muscle guarding. It's the same thing as, like, let's say you're going to stretch your hamstring and you put your heel up on a bar and you start to kind of lean into it and you feel that muscle pull and maybe some burning and sharp pain, and then your muscle starts to twitch and fight with it. That's muscle guarding, where your muscle has this built-in mechanism to protect itself, to contract so it doesn't get over pulled or tears. The traction's not going to do that because it's a softer pull, it's not an abrupt pull, and it's not a fixed pull. The negative G-force technology with the bungee system allows for motion in the pull force to vary based upon how your muscles contract. So if your muscle contracts more, it relaxes more. If your muscle relaxes, it'll pull more. Traction is much like working out, and it is very much the same as a part of having a healthy lifestyle. And if you think of working out with weights, it hurts, and the next day you really feel it, you're sore. You can work out, and then you may not be able to work out for days afterwards because your muscles are so sore and they're so tight, and you might feel like you're going to injure yourself. But the key is you don't want to stop there. You have to get back in it. The longer you wait each time in between working out, it's like you're restarting over again. Sooner or later, you may not like this saying, but you have to bite the bullet, and you got to get back on the horse, and you got to start doing it again to get past that point of pain, which is a natural progression of your improvement. Now, again, if it's injuring you and making you worse, that's a totally different story. I've had multiple surgeries on my neck. I have scar tissue, I have had shortening of my muscles in my neck, and I still use Fisher traction. And initially, when I started using it after my surgeries, after I was healed completely, and my doctor told me I was okay to try conservative care, I used my own Fisher traction, and initially it didn't feel that great. But I knew over time, if I kept using it and I was diligent about it, that sooner or later it was going to take effect, and it did. One of the reasons why we offer our 30-day money-back guarantee is that most conditions take about 30 days for any type of therapy or treatment to actually help. Now, you got to remember that whatever situation you have, you might have had this for years. It might be a chronic condition, so it's taken years to develop. Even though when you're on traction, it's taking the pressure off of your nerves, it's pulling the bones away from each other and away from the nerves. So it's working, but you may not feel any measurable or tell any measurable results for some time. It's taken years to happen. Don't expect immediate gratification and cure. I wish that was the case with traction. We want you to use Fisher Traction for at least 30 days. You want to use it frequently, like every day if you can, okay? And consistently every day for 30 days for at least 10 to 15 minutes. And the most successful actions we've seen is using it before bed or when you wake up in the morning, or if you're really good at it, you can do both. But that 30-day period of time is critical to see if your condition, your situation is truly going to benefit and react in a positive direction from the effects of traction and decompressing your spine. One thing you have to remember is that there are very few immediate cures where your problem is completely erased. And you have to be careful with anybody making claims like that, and that's not what we're doing here with Fisher Traction by any stretch of the imagination. Just don't give up too early. Let the process of the traction take its course with your body in changing things. This is not just for the elimination of pain, and I know when you're in pain and you're suffering, it's difficult to be patient and to wait things out because you just want the pain to stop. But with Fisher Traction, it's more than just the elimination of pain. We're trying to restore your body's normal function. I've heard from many people, especially women, about their ears. And when you use our release strap, another reason by using the release strap, you pull the release strap to release the traction, so then you can move your head around and readjust the head harness. It is a therapeutic grade pull, so it can cause a little constriction around your head, in your ears, and may even make the top of your head go numb. Those are all normal findings, and some of you might, in some cases, be stretching too much initially. And I know I've had people tell me that, hey, I'm scooting further and further away from the door. Well, that in itself could be counterproductive because your body may not be ready for that much stress force. How I tell you to set yourself up is for the neck, where you just line it up to your chin and your lower lip. That's about as far as you need to go because you can still use a release strap. You don't need to scoot further and further away because that more of that stretching might cause your muscles to fight even more and struggle where they can't relax, so that you can't truly feel the benefit of the decompression inside. Again, that's why we offer a 30-day money-back guarantee. If after 30 days, if you are worse for any of your complaints, then honestly, you really need to consult with an orthopedist because maybe you do have something that's going on in your body that you're not aware of, and maybe your other doctors aren't aware of. You might have to get an MRI to accurately diagnose what your situation is. In some cases, traction doesn't work. Typically about 80% in my practice, 80% or more have had great success with traction, but it's not the answer, it's not the cure-all for anything. And remember, nothing is.